So can you tell us the top maybe 3 or 4 types of cancers that you're seeing the most?
Cancer burden here in Bermuda is relatively similar to what you'd expect from other countries. There are some outliers, but like you see nearly everywhere, for ladies, the most commonly diagnosed cancer is breast cancer, and for men, it's prostate cancer. And within the radiation unit, we see most of those patients because radiation plays such a key role in curing and helping breast cancer and prostate cancer. Oropharyngeal cancer in men was the fastest growing cancer in the US in the last decade, and it's all been put down to HPV. So it's definitely something that is rising sharply.
We're definitely seeing an increase in HPV-related malignancies. The interesting point about the virus driving this, the HPV virus, the Human Papillomavirus, is it's that certain types of these are a cause of other cancers as well, such as cervical cancer in women and anal cancer. They are related to sexual practice, but sometimes it's an infection that's happened many, many years ago, and the virus embeds into the DNA around the oropharynx, the oral cavity, and drives the cancer maybe 20, 30 years later. And interestingly, prevention is always better than cure, and we're always talking about, decreasing smoking and alcohol-related cancers. Well, in this point with cervical cancer, we have an active immunisation programme, certainly in the UK, US, and Australia, and that's shown an excellent response in cervical cancer in women. We were trying to push that in the UK to include the boys, because then, in general, we can try and decrease the head and neck cancer and anal cancer. Yes, we have seen an increase in HPV-driven cancer, certainly in the head and neck region. All in all, the viral-driven cancers tend to do better with treatment.
Again, you have so many people that have the fear of vaccines. Would you encourage people then to look at vaccine, prevent HPV?
Yeah, so I think there's a number of options around now. And Bermuda makes the vaccine available for all by the government clinic. But despite that, the uptake is only about 30%. As you say, there's a lot of fear associated with vaccines, and there's a lot of concerns, and there's a lot of misinformation that gets circulated about vaccines. If you imagined you had something that wasn't called a vaccine, but pretty much completely stopped to reduce the chance that you got a certain type of cancer, and you could give it to your child. Say it was just a one-off tablet you gave to your child, and that meant there was almost zero chance that they got cervical cancer or oropharyngeal cancer. People should be jumping at it. But as it's a vaccine, with the kind of misinformation and the fear that it carries, it's remarkable to think that only 30% of people take up that opportunity.